pretty fabulous, isn't she? Did you know that in 2009, being a woman was a pre-existing condition for all health insurance? And that 51% of our population was paying more just because they were a woman. At that time, I was in New York City at Planned Parenthood Federation of America when then Speaker Pelosi was leading the charge as the chief architect of the Affordable Care Act. And I was able to see close up her tenacity, her focus, and her action. So in the words of the great Alicia Keys, this girl is on fire. You can try, but you will never forget her name. She is on top of the world. Since her first days as a U.S. Congresswoman, Pelosi has always demonstrated an unwavering commitment to supporting health equity for those most in need. From bringing awareness and resources to the early fight of HIV/AIDS and being a champion of women's health, and then spearheading the Affordable Care Act. She expanded health coverage and protections for millions of Americans who wouldn't have had health insurance otherwise. Her leadership in health equity is second to none. She knows how to count her votes and get it done. As we honor an impressive milestone in public health in our city, we know that our vision for health care for all could not withstand without Congresswoman Pelosi's tireless support of our community. Tonight, we celebrate and recognize Speaker Emerita Nancy Pelosi's unwavering commitment to the fundamental values of access, equity, and health care for all, and present her with the award of the San Francisco General Hospital Foundation Lifetime Achievement Award.
Thank you, thank you, thank you. Thank you not just for your kind words, not just for this beautiful award, but for making so much possible in terms of health equity in our country. Thank you, Kim, for your wonderful award, your kind words, but also for your great leadership. Thank you. You have made such a tremendous difference. We're also very, very proud of you. Thank you. And we've heard stories. We heard about the mayor's cousin, Marsalis, there he is. We've heard about Priya's husband. We've heard about the Senator Feinstein's father. We've heard great stories, and I'll tell you my story in a little bit about my husband, Paul. But it's just only the most recent reason why I have such a full appreciation for San Francisco General, just such a remarkable place. Now, we talked a lot tonight about equity, health equity. Health equity is central to who we are in San Francisco and is being reflected in the policies of President Biden. We heard from the Secretary. Mr. Secretary, are you still here? He's still here. The Secretary was there when we wrote the Affordable Care Act and is very much a part of it. Thank you for being here to represent the administration of President Biden on the 150th anniversary of Zuckerberg San Francisco General Hospital. It is an honor that you were here. You said you were where were you today? Were you in Chinatown? I want you to know that over 40 years ago, I took the Secretary of HHS, Joseph Calipano, to Chinatown, to the senior center there, the same one you went to today. So thank you for keeping listening to San Francisco about how we can do things. You saw John Lewis in one of those pictures, and it was reminding me that Martin Luther King said, of all of the inequities that are out there, the inequalities, the most inhuman is the inequality in healthcare, because people can die. That's what Martin Luther King said. And it is true that in order to have equity, fairness, justice in healthcare, you have to make a decision to do it. And San Francisco General made that decision decades and decades and decades ago. The governor talked about the early years. Of course, we know after the earthquake, and he filled in some years along the way. And I will pick up on HIV and AIDS. But before I do, I want to say it's no coincidence that whom we heard from tonight were Mayor Breed, Governor Newsom, formerly mayor of San Francisco, Dianne Feinstein, formerly mayor of San Francisco, because it has been a priority of the mayor's office to support health equity in our city, to the point that San Francisco has been a model to the nation. Mayor Breed, thank you for your tremendous, tremendous leadership, for making it personal tonight, but also for making it so important, the decision you have made to support it. And it means not just about the services, it's about the data, it's about the personal contact, and you have all, whether continue with HIV AIDS, but also COVID and the rest, in those manifestations, we couldn't be prouder than how you have handled all of that. Thank you, Mayor Breed. So I don't have the microphone to walk around, but I want you to say this. Thank yourselves, because you have all been a part of making America healthier. Not just about healthcare, but healthier. When we talk about San Francisco General, I think back, oh my gosh, during HIV and AIDS, when we would go there and hold the patients in my arms, were my friends. They had been these athletic young men and women and all the rest, but especially, as you know, men at the time. And then they were just frail, but being treated so, so very beautifully. General Ward 86. Anybody remember General Ward 86 here? General Ward 86 not only took care of those patients, it established a model for the nation. For HIV/AIDS, and that's why I say thank yourselves, when we wrote the Ryan White Care Act, when we wrote that legislation, Javier was there, you remember this, Javier? Mr. Secretary was there, you remember. It was modeled after San Francisco. Community-based care, community-based research, community-based prevention. And that's what San Francisco General has always been about, the community. Learning from the community, building the legislation. But it really, without any exaggeration or boasting about this great city, really was a reflection of what was happening in San Francisco. Then we go to the Affordable Care Act. The Affordable Care Act, San Francisco General is a model for the nation of what we call value, not volume, to show the rest of the country about how you take care of patients. And when they go home, as you saw in the film, and when they go home, that they are able to function. San Francisco ranks high in the nation as having the lowest re-entries because of the value of the treatment and the recognition of when they go home. It's a big deal because it involves a lot of money, and we want it to be spent in the best possible way. So you go in every category that you go, what is the quality way to do it? But you keep coming back to equity. You keep coming back to justice. If we want to treat everyone with the respect that they deserve, the care that they need, in a way that takes them to a better place, and that in terms of their health care. And one of those places, Mr. Secretary, is Laguna Honda Hospital, which is very important to all of us. And I thank you for the attention that you are paying to it. And our president, he always says when we're talking about any subject, talk to me about the workers. Tell me about the workers who work there. You've heard me say this. You heard me say it the other day at the Presidio, Mark. And the thing is that our workers at Laguna Honda are so wonderful. We had the minimum, right, Mayor, the lowest amount of percentage of deaths from COVID for the number of people who are treated. We have to come to terms with certain requirements of the federal government, but understanding that it is within a health bonding community where we value health, whether we're talking about health, just being healthy, or being assaulted by HIV, AIDS, and then, of course, COVID after that. So understand what San Francisco General has been. It's been a community-based healthcare facility which has healthcare professionals at every level who give care, and who care. And they have done it in a way that is so remarkable. So when we write legislation about healthcare, and we look to the models that San Francisco provides, the policy is better because the care is better here. Whether we're talking about UCSF, of course, and the connection with San Francisco, Zuckerberg San Francisco General. So it is for me to get the Lifetime Achievement Award. Well, my political lifetime, when I went to Congress, first words on the floor were about HIV/AIDS. They said, why did you talk about that first? Why did you tell people that was why you came to Congress? I said, well, I told them that because that is why I came to Congress. But it is. So in any event, a political lifetime achievement award. It means so much to me. I am so proud to receive this and so grateful to each and every one of you. As the governor said, all of you should take great pride in what San Francisco General is, not just to us in our community. That would be reason enough. But the model it is to the nation. As I said, value of treatment, not volume of reentries. San Francisco General. Again, a community, any health issue you can name. And we have some right on the streets of San Francisco now that will have to serve as a model to the country. But I do want to thank Elizabeth Minnick for making this wonderful evening so lovely. Judy Guggenheim and Pam Bauer, who are responsible for so many hearts that we have in our house, our homes. And again, as I said, the mayor. I want to make special recognition, though, as I tell our story about our experience. Dr. Jeff Manley, who is up late tonight. He usually is at the hospital by 5 o'clock, so he's out late tonight. So I would say I'm going to cut it short, but my kids would say to me, "It's too late for that, Mom." You're already gone beyond that. Dr. Jeff Manley, just representing the best that there is in our country and the world. And he really saved Paul's life. That's my story about Paul. When I got this knock at the door in the middle of the night in Washington, D.C., what could it be? I run to the door, and the security is all there, and they said, I said, "Is it my grandchildren? Is it our children?" They said, "No, it's Paul, it's your husband." And I said, "Well, what is it? Where is it?" They said, "Well, we don't know. We don't know." I said, "Well, did they take him to the hospital? You know, what is it?" I mean, they just didn't know anything. But when they said he was going to San Francisco General, that was when I was very relieved. Not that we don't have great hospitals in San Francisco, but the trauma center at San Francisco General is world acclaimed as simply the best. So thank you, San Francisco General, for taking care of Paul. Thank you, Jeff Manley. Stand up, Jeff. Thank you. In saluting Jeff, we're not only saluting all of the other healthcare professionals who were there and who work in such a beautifully coordinated way, but all of the people, the healthcare providers, of course, the doctors, the nurses, everyone there, but also the support staff who are so lovely, so gracious, and sometimes not fully appreciated, but they are at San Francisco General. So in accepting this, I do so again of my most recent reason for gratitude. But so many times, many of us, and I could go around and talk about many of you in this room, and you probably think I will, but Jeff has to go home to go to, so 5 o'clock he has to be at the hospital. Here's the thing. We've been in front of San Francisco General, many of us, when we talked about gun violence and stopping gun violence. Right, Ron Conway? We've been there just talking about, and you've been such a leader, stopping gun violence, a major health issue in our country. We've been there when we've talked about reducing the cost of prescription drugs, having people from the community talk about what it means to them, and the Secretary referenced that in our legislation. We've reduced the cost of prescription drugs. For seniors now, we have to do it for everyone. For insulin, now we have to do it for everyone. But going there, because people felt a comfort level to go there. You don't have to tell them where it is. They just show up to talk about two subjects that we talk about, the need for the cost of prescription drugs, the toll of gun violence in our country, but it goes on many other things. So it is not just a hospital, not just a miracle worker, not just a place that sends people home, but a connection to them, but a community center for San Francisco to know that there is where we have shared values, deep concern for people, a model to the nation in terms of what they would like to be like, but also writing the script of what we should have in legislation, so that when we get time to divide up the pie, as we say, make grants coming back, the standard has been set here. It's not hard to compete for dollars when the standard is set here, and we want everyone to reach that level. So this is important to me. I will display it with great pride. Still have an office in the Capitol, so I will display it with great pride in the Capitol. 150 years Who knows what the future will hold? We'll go so far into the future in this magnificent city of San Francisco. And it's a city that is prayerful, and a city that I'm very proud to represent in the Congress. I'm very proud to represent San Francisco values, especially as they are reflected in San Francisco General Hospital. Thank you. One more thing. I just want to say what an honor it is to receive this award when we are also recognizing San Francisco's Heroes and Hearts awardees, Nayas Arriego, Merjo Rocco, and Joan Torres. You make this honor even more special for me. Thank you all very much. Thank you.